Hello, I'm Sergio Petrucci of Red Sky Foundation. We're here today to show you exactly what to do in a real life situation should a medical emergency occur. If someone is having a sudden cardiac arrest, we're here to show you exactly what to do should that situation arise. I'm here with Paul Brolly from our partners at the NHS and the North East Ambulance Service, who are going to deliver and demonstrate a full educational session so you understand exactly what to do and you have the skills to deliver CPR and successful early defibrillation.
Thank you, Sergio. I'm Paul Brolly from North East Ambulance Service. I'm a training officer. I'm here just to break the things right into a simple format for you to do on a real life situation if this ever does happen. The main thing is you've seen on the photo pitch that people were calling 999. That's what we want from an ambulance service at a medical incident. Get that phone call going as quickly as possible. Then the intervention of people doing CPR, which will help this person regain life or give at least the ambulance service something that they can work on and hopefully get that person to hospital. So there is 4 links to that, which is ringing the 999, doing effective CPR, which I'm going to demonstrate, getting a defibrillator, again, get a defibrillator from anywhere and get that onto that person as quickly as possible. And then from there, the ambulance service will take the person off to hospital and hopefully we get a good ending from that overall episode. So CPR itself, if we find ourselves come up to the incident, just like you've seen on the football pitch, we need to do various checks. The main thing is checking for danger. Danger to ourselves, danger around the individual. This might happen at home, this might happen on the streets, and it might happen on the football pitch, as you've just seen. So danger itself, we're looking all around, making sure there's no danger to me. If there is any danger to me, we don't proceed. We step back and make that 999 call. After that, once we're happy we're safe, we need to check on this individual to see if they're okay. So what we want to do is see if we get some form of reaction. It could be someone sleeping, so we just want to give them a little tap on the shoulders and see if we get them moving. So we just get down beside our patient and just tap and chat to them. Hello, can you hear me? Can you open your eyes? We give them some simple words of command. Hopefully that individual will open their eyes. Then we know it's not a real 999 situation, but it could be something wrong with them, which means we need to follow up with maybe a 111 call or getting this individual off to a medical centre of some sort. If we don't get any reaction to that individual, that's when you would call in your bystanders, just as you've seen on the photo pitch there. People will get their mobile phones out and start ringing 999. For me now, I need to go into my ABCs. A is for airway, so we'll check the response. What we're going to do now is making sure that the airway is nice and open. All we're doing is putting 2 fingers underneath the chin and putting a hand on the forehead. And we just tilt that right back. And what we're doing is opening up the airway and moving the big fat tongue away from the back of the throat. So 2 fingers, hand on the forehead, tilt the head back. From there, then we're going to check for breathing. Breathing, we're going to use that for up to 10 seconds. So we're just going to get our ear down, listen, look to see if it's in the chest and rise and fall, and hear if we can hear any breathing at all. We're going to go for a worst case scenario to say that this person is not breathing. Before I start doing any compressions, CPR, I got to make sure that the ambulance service is en route. We don't start doing CPR until that has been summoned. If I've got my mobile phone, as I've already said, or bystanders are making that phone call, I can proceed to do CPR. CPR, the heel of the hand goes into the centre of the chest, the other hand goes on top, and all we're going to do is keep the elbows nice and straight, and when we press up and down. What we're trying to do is go down 5 to 6 centimetres on an average adult. If this was a younger child, we'd go to 1/3 of the depth of the wall. So basically we're looking at this, the heart as being a fist, and we're going to do push it down, and we must get a good release. And what that is doing is effective CPR, getting the blood from the heart up into the brain. So demonstration of that, heel of the hand, other hand on top, stay nice and tall, and we're going to go for 30 compressions. Once you've done 30 compressions, then if you're trained, willing and able to do the rescue breaths. How you would do that, you would pinch the nose, tilt the head back and give 2 effective rescue breaths. A lot of people do not do rescue breaths nowadays, but the gold standard is still 30 to 2. If it's someone you know, love and are willing to do the rescue breaths, then you would do the rescue breaths. If you're not doing the rescue breaths, you would carry on doing uninterrupted chest compressions at a rate of 2 a second, which is about 100 to 120 in a minute. And you would keep doing that until you get too exhausted, someone else comes along and helps you out, a defibrillator arrives, and you work in conjunction with the defibrillator to put CPR and the defibrillator at the same time. Or if a medical professional tells you to stop, such as the paramedics have turned up and they have taken over. Hopefully that has helped you with the CPR. The next little demonstration we'll do is put the defibrillator on the mannequin and talk about that.
Thank you, Paul. What you've just witnessed there is how to deliver successful CPR. What we're going to show you now is how to use a defibrillator that could be on the scene and that can actually save somebody's life, and it is literally the difference between life and death. What we have here is a defibrillator which is live. It has a green button and a red button to deliver the shock. What Paul's going to now do is show you exactly how to use a defibrillator using a training device, whether it's on a paediatric patient or an adult.
Hello, thank you, Sergio. Yeah, we've demonstrated how to do CPR. Now we're going to talk about defibrillators. Defibrillators come from different places. Remember what I said at the start. Remember, in this situation, we had to call 999. A call handler will then direct you or the person closest to you to go and get a defibrillator. These are called community public access defibrillators. Some football grounds have got their own in their first aid kits. Some people have got them on the side of buildings. Some people are inside buildings. When you ring 999, if it's within 500 meters of that incident, then the call handler will give you a code, the access code to the defibrillator box for someone to go and get, bring back. In the same time as that's happening, someone is carrying on doing CPR. We never leave the patient alone. When the defibrillator arrives, you just press the on button and follow the prompts. There's no reading of any instructions. Literally, you just listen to what it says and put on the pads where it will show you to do. Simple little demonstration of that is the pads. All manufacturers will have pictures of the pads and showing exactly where to put them. All pads will go on the top left, as you can see, and down on the bottom right. Okay, with the pads on, the machine then will go into analyzer mode, and what that means is between 6 and 12 seconds is normally the time. And what basically doing, it analyzes the heart to see what the heart's doing, if the heart is in a shockable rhythm or not. If it's in a shockable rhythm, it will tell you to press the button. If it's a non-shockable rhythm, it will say carry on doing CPR. For us lay people, we want to carry on doing CPR until the ambulance arrives. So if the shock is advised, you press the button. If there's no shock advised, please start CPR again. This will happen every 2 minutes with a defibrillator. It'll reanalyze every 2 minutes.
Analyzing heart rhythm. Shock advised. Stand clear. Press the flashing orange button now. Shock delivered. Begin CPR now. Press the flashing blue I button.
If the defibrillator has got an I button,
CPR
that's going to
voice
assist you doing CPR.
First. Breathe. Breathe. Fifth.
If you are going to do breaths, as we said before, you're trained, able to do the breaths. Normally we don't do the breaths due to various different reasons, but the main thing you got to think about, the gold standard is 30 compressions to 2 rescue breaths, and this is normally done on a loved one or someone you know. That was a quick demonstration of using a defibrillator on an adult patient. There's a lot of defibrillators out there with different sort of gizmos, gadgets, but there is the main difference on a lot of them. With this one, as you can see, it's got an adult and a child. And all you would do, if this was an 8-year-old or younger, approximately 20 kilos in weight, it's about 3 stone, so under the age of 8, you would just literally switch it from adult mode down into pediatric mode, which basically reduces the voltage of the shock. If you have not got this flick switch and the only thing you've got is adult pads, you would put the adult pads on the front and the back in line with the patient itself. Hopefully that was beneficial to all of you watching this. gone through from the CPR. Remember, doctors ABC, danger, response, airway, breathing, and compressions. Let's get those compressions done as quickly as possible. Keep those compressions continuous. The defib arrives. You've all seen now how easy it is to use a defibrillator. Press the on button, follow the prompts, and deliver the shock if required. Hopefully this will never ever happen, but we're here for that time that it may happen. To that end, we all know that it's a stressful situation you may be in. More people get involved, the more people who've been trained on CPR and know how to use the defibrillator, the quicker access to these defibrillators onto the patient, the better result it is for that individual. So again, thank you for your time. I hope that was okay for you, and stay safe.
Well, that's the end of our training video to show you exactly what to do in a sudden cardiac arrest situation, a medical emergency some people call it. Whatever does happen, I do hope that you're able to now save somebody's life and that you can take this on and share it with as many people as possible. And thank you so much for supporting Red Sky Foundation. It really does mean the world to us. Thank you.